All right. Well, here we are on Healthcare Unfiltered. I am really honored to meet for the first time, actually, via social media, Dr. Humaid AlShamsi, who I got to know through Twitter. So, despite the fact that Twitter, I have a lot of issues with Twitter. For those of you who follow me, you realize that. But there are certain good things about Twitter, which is we get to meet people that otherwise we may have not interacted with. And I've asked Dr. Al-Shamsi to come on this show because I've had a lot of interest in understanding oncology care outside of the US. We've already taped a couple of episodes on this, and Dr. Al-Shamsi actually wrote even a book about this. So we're going to go over that as well. So, Hamid, welcome to Healthcare Unfiltered. This is your first time on this podcast. Hopefully, it won't be last. If you play your cards right, I may ask you again. So, be careful. But
it will be my pleasure anytime, inshallah.
But for folks who don't know you, just a little bit about you, who you are, and how did you end up in the UAE currently? Because you've gone all over the world. I've read about you, and tell us a little bit about you, your training, where you were, and how did you end up in Dubai, in the UAE currently?
Okay, so basically, I'm from here. I grew up in UAE, and I always had a passion for medicine. When I finished my high school, I went to Ireland where I studied medicine for 7 years. I did my internship. Then I went to Canada where I went to McMaster University of Ontario, where I did my internal medicine, followed by medical oncology, followed by palliative care, followed by GI oncology. And then I was just about to come back home. And then I said, you know what? We have to go to the US. The US is the hub for oncology. And actually, I did apply for a fellowship in GI at MD Anderson, but they said, hey, you're already trained, you're qualified, come and join us. So I was a little bit, not sure initially because I had to do the USMLE, I had to go through this pathway. I wasn't licensed in the US, but I decided to take 6 months off. I've taken 6 months off. I've done the USMLE, and then I went to the US. This was back in 2014, and I was an assistant professor at MD Anderson at the GI and Medical Oncology Department from June 2014 until February 2017, so almost 3 years. And then it was time to come back home to the UAE after 20 years away from home. And I returned home, and maybe that's why I started the story. We can talk more about the book. But I do like I like research, academia. But when I came here, I just found out we don't have any basic science or even database to go back to. So I started looking into the research in our region. That's why I'm more focused in research about the Middle East and UAE and oncology.
So, Hamid, what made you go to Ireland first? Did you have a family there, or was there something specific about Ireland? Was it easier to go there, or how did that happen?
Well, actually, I think it was mostly a chance because I forgot to mention that I did my high school in UK. So after I finished my high school in UK, I applied to medical schools in Ireland and UK. So I ended up in UK in Cork University. So that's why I ended up in Ireland. But at that time also, we didn't have many actually medical schools in the UAE, which is different right now. We are in 2022. We have at least 8 or 9 medical schools. But at that time, we had only 1 or 2 maybe medical schools. And studying abroad and getting more experience, it adds more to the knowledge and the experience. And we do have scholarship by the UAE government. That's why I ended up in Ireland, and then I went to Canada.
I'm fascinated by your journey. So you're born in the UAE, but you actually you went to the UK, Ireland, Canada, US, and back in the UAE. So literally, you really you understand medicine globally, like in several countries. That's really very unique, and not very. I don't see that commonly.
To be honest with you, I do see that I'm lucky because, as you mentioned, I've been exposed to different health systems, like in Ireland, in Canada, and US, and when people and UAE as well. So when people talk about health systems in different countries, I can relate to the UK, I can relate to Ireland, to Canada, Canadian system, also the US health system. So yes, I've been lucky to get exposed, and certainly this has shaped the way I think about medicine and oncology, and also the value-based medicine.
Have you thought about staying in the US? A lot of folks who practice medicine in Canada and the US struggle in going back to the Middle East or their home country for a variety of reasons. I think what I normally hear is because of the lack of research or the lack of drugs that are available in the US, in these countries. Sometimes financial incentives. They say we get paid more in the US or in Canada. As you were at MD Anderson, one of the best cancer centers in the world, what made you, like, how did you make that decision? Was it difficult? Was it hard? Take me through what made you decide to go back to the UAE.
Okay, I'll tell you a small story which may summarize how did this happen. When I went to my internal medicine interview for the first time in Canada, my program director asked me, what do you want to do in 10 years? And I told her I would like to change the landscape of cancer care in UAE. And she said, what? I said, I would like to change the landscape and the way we treat cancer in UAE in 10 years. And she said, you know what? I like you and you are in. And the system actually is different in Canada versus the US, where you have to match and then you have to wait for the match. And I do remember there were applicants waiting outside the interview room, and she said, you're in. I said, are you sure? She said, yes, I am. So my point is that my mission was always very clear from the time I started thinking about oncology. In fact, I did some research. I came back home. I went around and I looked at the resources, the available manpower. So my decision to do oncology was not just a random decision. It was based on the need of the country. So my mission was very clear: go abroad, get the experience, and come back home.
Did you ever? I mean, a lot of people have that mission, but they may not be able to stick to it for a variety of reasons. Were you concerned when you made the decision to go back that you may not have the resources that you need? Or did you have to call people ahead of time, like hospitals, even government, and say, hey, I can come back and do a lot of things, but you need to also pitch in some resources for me?
Yeah. To be honest with you, the first 2 years where I've been here exactly in UAE for the last 2017, now 2022, almost 5 years or 5 years and a half. The first 2 years were very, very, very tough in different ways. Number one, people don't appreciate exactly what's your background. So, I mean, even though they know it's in Anderson, but they don't know how much time you spent abroad, how much knowledge you have. And every time you want to make changes, you have this, reluctancy to make any changes because it has been always done this way. And we're going to keep it this way. So it was difficult. It was tough. And again, this goes back to my point of writing or editing this book to try to make a change at the level of the Arab countries. So I did try to make some connections before, but it's always difficult when people don't know exactly who you are and what you are trying to do. And it wasn't easy, but certainly takes time. After the third year, after writing, publishing, we published more than 56 publications over the last 30 years. And again, most of my publications actually focused about UAE. I've been using the social media a lot to increase the awareness. And it did work, actually. People start recognizing the mission that I do have, and actually of my team as well. And I'm very proud of many changes we made actually in the last few years. And in fact, I do have a meeting in the next 2 weeks with the Ministry of Health in UAE, trying to address the major challenges and how can we come up with a plan to improve the cancer care in UAE. So this was my target, always to make the change, and are we getting closer to that target?
That's wonderful, and we'll go over some of the changes that you've made. So what is your current position? Where are you practicing currently? How many days do you do clinic versus administrative things? And take us a little bit through some of these things. And I see myself frozen, but I'm back.
Yeah. So basically, currently, I'm the director of Barjeel Oncology. And what's Barjeel? Barjeel, actually, it's a private entity. When I started with them 2 years ago, it was a single unit oncology. We had no radiation, we had no PET scan, we had basically nothing. But over the last 2 years, we built the most comprehensive cancer care network across the UAE. We have 7 centers. and I'm the director. I'm not the owner, but I'm the director of the service. And we do have the largest oncology team. We have 17 oncologists and hematologists in the UAE. Also, we have the only pediatric and adult BMT unit in the UAE that I established with our team. We performed 27 BMTs, including allogeneic and autologous for adult and pediatric over the last 10 months. And again, 10 months is a very short period of time to achieve these goals. And we are the most publishing group in the entire country when it comes to oncology and cancer care. We established the first palliative care unit in the capital, Abu Dhabi, and we are serving, 1,000 patients over the last 2 years.
And for those folks who are not familiar with the UAE, there are several segments of the UAE, like different cities or states. So you have 17 locations. In each state, there's a location. You have 17.
No, we have 7 locations, but we do have 17 physician, hematologists, oncologists, and radiation oncologists.
So you have a location in each state, pretty much.
Yeah. So our model is to reach to the patient. So we do have the main center that's in the capital, but we do have small centers across the country. Again, cancer patient, they cannot drive for 3-4 hours. So I do 3 days in the capital, 1 day in my own city, which is 2 hours away. And tomorrow I'm doing, for example, a clinic in another location, which is actually also 2 hours away from the capital. So by this model, we can reach the patient, make it easier for them. We deliver treatment, either chemotherapy or surgical, approaches locally to them. But if they need radiation, they have to go to the capital to receive the radiation treatment.
Got it. Humaid, tell me about chemotherapy in general. Is everything available in the UAE, and maybe the insurance piece? Is it out of pocket, fee for service, or is there health plans and health insurance that the government or like private payers? How does that work? And let's say a drug gets approved by the FDA this month. How fast can you prescribe it in the UAE?
Okay, so let me answer the drug thing approval first. We have been actually pushing to get approval for the medications. Many medication has been approved in the UAE immediately after being approved in the US, and this is actually in collaboration with the pharmaceutical companies. We approach them, we tell them we need these drugs. So the drug accessibility, mostly, not always, mostly, not an issue, because of our role, and also the government is very committed to make medication available. We do have very unique problem in the UAE where we have many patients with cancer. They travel abroad for cancer care. And this is a very challenging problem because the government actually is supporting these patients. For example, patient wants to go to MD Anderson, the government will pay for them to go to MD Anderson. They want to go Sloan Kettering, they will pay for them. They want to go to Mayo Clinic. So the concept is patient, mostly they want to travel abroad. Actually, we're trying to change this concept where we do have the resources available, we have the skills, we have the experience, especially patients with advanced cancer stage 4. They cannot live the rest of their life away from home just because they're getting palliative treatment. So regarding the coverage, every single citizen in UAE is covered by the government. So they receive completely full treatment, either simple treatment or very complex treatment, expensive treatment, doesn't matter. They're completely covered, and they can be treated in either private or public hospital, and they're still covered.
Wow. So even
Yes.
if they private,
yes,
that is amazing.
Yes. On the other hand, when we have the expats who are 90% of the population in the UAE, they need to have insurance. And again, the insurance, varies between top, insurance versus very basic insurance. And there's a wide variation between these different insurance. But I can tell you, almost everyone in the UAE, either living here or the citizen, they do get treatment. Some cases when they max out in their insurance, they have to go to some charity hospitals, and there are some in the country as well.
Yeah, and we'll go over once we start talking about the book. We'll be able to see the variation, but that is really very interesting. So as you went in, at least from a drug access, for the most part, you have them, and you can
Yes,
lobby for the newer ones. You mentioned something that intrigued me about bone marrow transplant.
yes.
And I think we all know that transplant and a lot of oncology care requires really very good nursing capabilities. I mean, no matter what, you're not going to be with the patient day and night, but you're hospitalized patients with the nurses. When you went back, how did you feel the nursing capabilities are? Did you have to focus on nursing education, especially with transplant? I mean, these are very sophisticated nursing skills.
Well, actually, you're touching a very critical issue and a challenge that I faced when I got home. Again, nurses here actually they're not empowered enough to do things the way we're used to them in the US and Canada. For example, you could be giving a wrong order and the nurses will do it because you gave it to them without even questioning the accuracy of the order. Do you know what I mean?
Yep.
And but in the US, even if you are attending, if you're a professor, it doesn't matter if you give them a wrong order or a questionable order, they're gonna question you and they're gonna ask you like, hey, can you review this again? Are you sure you want to give this, or is there rational? So they can. I will not say they challenge you, but they try to make sure you're doing the right thing. And again, I think this is because the culture here, the look at, they look at the nurses as just more like a service. They're providing a service. They're changing the bed sheet. They're giving the medications. But the value actually of their nurses, as we know, it's much, much more than that. So what we did in our group, actually, we did lots of training for nurses. For example, when I do around with the nurses, I tell them, like, this is the way you have to present the information. When I ask you this question, you can be confident. You can also, tell me this would happen overnight. So I try to encourage them to be more, engaged with the discussion, with also decision making, which is something that they're not used to.
This is amazing to me that you're doing this. Are there nursing schools in the UAE, Humaid?
Yes, there are lots of nursing schools, but the reality is it doesn't attract many local nurses from the UAE. We do have lots of nurses from India, from Philippines, but again, they usually come to us, they get the experience, and then they travel to US,
Yeah.
Canada, and Ireland, basically because they're gonna have long commitment there. Once they go, they can get that settled citizenship, because usually when they come here, they're only on work contract for a period of time, like 5 years, 10 years, but they want to settle. So most of them, they do travel. In fact, I did lose a good nurse, charge nurse for the chemotherapy just a few weeks ago. She traveled to the US because
Yeah.
she wanted to have long-term plans.
But that is I mean, that's, to me, as I listen to this and I see how innovative you are and how passionate you are about this, it may be an opportunity to carve out certain things with policymakers, with governments. Like, look, if you really want to really make things different, maybe we should have some exceptions to certain talents. So that's something I'm pretty sure you're capable of talking about. Maybe it's something being discussed already.
In fact, things has changed over the last few weeks in the UAE. There's something called golden visa, where people with the special talents, including nurses and doctors, they can get a special visa for 10 years and they can renew them at that time. So definitely things has changed since the pandemic and the huge shortage that we had in physicians, nurses. I mean, definitely people and also organizations, governments, they do appreciate the health sector more than ever before.
So all of the physicians there are paid by government? Like, are you paid by the government, or
No.
I mean, because your government is covering the patient's care. So how do physicians get paid?
Well, you either work for a government hospital or you work for private hospital, but both of them are being reimbursed by the government.
I see. But the hospital,
So
the private hospital pays you.
institution, yes, the institution will be reimbursed, and then you'll be paid through your institution.
Okay. What are the, as I migrate into the book a little bit in 2 seconds, but what do you want to see in the UAE over the next couple of years? What's on your strategic plan, maybe in the next 2 to 3 years? the short goals?
Okay, so if you asked me this question 2 years ago, which actually we did publish a recommendation about how to improve the cancer care in UAE, building a BMT unit was a priority for us for a simple reason. There was no bone marrow transplantation unit in the UAE, and we have around 200, 300 cases per year traveling abroad. And you can imagine the amount of the money the government is paying, not only for the process of BMT, but also for the families, for accommodation, the time lost from work. So this was a big commitment from our end. And what pushed us to do this during the peak of the pandemic was we had many patients who needed transplantation and they were stuck. You remember there was a period of time, maybe it was not in the US, but many parts of the world that, no traveling was allowed for a few months, and we had many patients that are stuck. So we decided we had to do that actually, and we decided to build the BMT unit at the peak of the pandemic. And I can tell you, many physicians, they joined the team for BMT and they left because they did not believe this is going to happen. In fact, they had a few people from UK, one from France. Again, I'm not a BMT doctor, I'm a medical oncologist, but I was in charge of the program. I'm still in charge until now because I have to make sure it's still running. They came and they didn't believe it's going to happen and they left because it was so challenging. The infrastructure is not there. Even that we didn't have a clear checklist how to build the BMT, if you understand what I mean. So we start from recruitment of the manpower for the nurses, getting some of the medication that's not even available in the country because nobody has done BMT before, getting the machines, getting the stem cell lab. Everything that was done during the pandemic, and this is something we're very proud of because again, without someone trying to push for this to happen, it wouldn't have happened. And we did this because of the need. And if you ask me what am I looking for now over the next few years, I'm looking to improve the quality of care. We do have almost 80 or 90 oncologists. They're coming from different backgrounds, some from US, some from Canadian training, some from Europe, some from Asian countries, some from the Arab countries. So there's a huge variation between the experiences and also the practices. And I can tell you, I really believe that there is a huge room for improvement. And in fact, this is on my document, which I'll be submitting to the government in 2 weeks' time, is we need to enforce MDTs for every single cancer case.
That's amazing. So is there right now in the UAE, are there fellowship training? Like, is there a couple of universities? You talk about medical schools, obviously, but advanced training, and are there fellowship programs for Hem/Onc right now? And how many are there, and how does that work?
I'm currently the chairman of the fellowship training program in the country, and I've been appointed actually in May. And we are building the first comprehensive program across the country. And I'm supposed to do a presentation, the final presentation in 2 weeks. Thank you for reminding me, in 2 weeks' time. So currently we don't have any accredited program, but actually this is our mission to build an accredited program for the country. It's going to be 3 pathways, either pure hematology, or either pure medical oncology, or combined medical oncology and hematology. And we're doing this just to give all the institutions the option of choosing whatever is best for them. But myself, I do believe that we need to separate medical oncology from hematology. I'm not sure if you agree with me, but the field is so complex now. It's very hard to keep up with all the data and the changes happening on semi-daily basis.
Well, even within medical oncology, so for example, you have 17 physicians, and I know you were a trained GI oncologist and a palliative care, but I presume it's really impossible just to do GI oncology. No, I mean, you have to see other areas.
Definitely that we see, but we do know that we know the preferences of each other. Like I know my colleague prefer to do gynae, I prefer to see GI, but we still do everything. I do everything in solid tumor, but I don't do anything with hematology because again, it's separate training. And in Canada, you either do medical oncology or hematology.
Yeah. Are you able to do CAR-T cellular therapy at the UAE?
Well, actually, this is our next project, and actually, we're in discussion with different providers. We did discuss with some providers, the well-known names. I will not mention names, but their expectation was very high, very complex process. So we went to different pathway. We're in connection with Chinese manufacturer. Also, we are looking into another manufacturer from India, and they do have actually excellent results. So we are in the discussion with them how to run a clinical trial first, and then we can bring it to the country.
And then I mean, I think it's pretty complex what you mentioned, and I'm honestly fascinated how much you've done in a short period of time. But tell me about how the interaction is with the U.S. institutions. We hear about Cleveland Clinic, Abu Dhabi. We know Hopkins has a presence. Mayo probably has a presence. Is this purely to bring research studies? Is it to bring nursing? Is it to bring physicians from Mayo? I mean, I don't understand that, but we certainly, I know from my colleagues here at the Cleveland Clinic, there's a Cleveland Clinic Abu Dhabi, but I have no idea what that means.
Yeah, so basically the UAE government is very committed to provide state-of-the-art, services and cancer care for their people. John Hopkins was in charge of the administrative process for one of the hospitals, and then Cleveland also was in the process of also administrative care and also supervision for one of the hospitals before opening the large building in Abu Dhabi. Also, Mayo Clinic is operating one of the hospitals called Sheikh Shakhbout in Abu Dhabi. From my point of view, I think the only issue that they are coming with the US mentality, and they are not looking at the local aspect of the cancer care. There are so many challenges, and I keep telling everyone that, even when I meet with them. In fact, I met with the clinic maybe a month ago, and I told them, you guys have to think away from the US, perspective. Our patients are different. They think differently. They even the way you approach them regarding the treatment, providing treatment, even discussion about palliative care, DNR, everything is different. So you cannot really implement what you're doing in the US, in the UAE. Again, this is very, very, very interesting area, but this is what I see the challenge actually with the US institution, the UAE, and that's why I decided myself actually to work in an independent way, somewhat, to try to provide the cancer care from the US perspective, but also from a local perspective, because I know how people think. I look like them, I speak their accent, my name is similar to their name, and I look like them. So it's different when you deliver the message. People do, accept the message from someone who is very close to them, and I do hope that, I've been successful in this.
There's no question that the cultural similarities between physicians and their patients do play a role in establishing trust factor. There's no question about that. I guess my question was more along the line, like, what is the level of affiliation? In other words, so when you say Cleveland Clinic Abu Dhabi, does that mean all the trials that we have at the Cleveland Clinic here are available? Like, what does that mean? Is it just a marketing thing, or is there like more?
No, actually, they do have some physicians who are actually from Cleveland Clinic. Also, they do have physicians from Mayo Clinic practicing, but it's not the entire hospital. So you do have some physicians who practice at Cleveland Clinic or Mayo Clinic are being, employed in this institution, but the most of the actually other healthcare providers actually from the local, I would say, local training or from the region, but they're not all from Mayo Clinic. But they do follow the guidelines and the principles from their mother institutions.
I see.
But regarding trials, no, they're not running. If you're running a trial in the US, it's only the US. It's not in the UAE.
Right. And are you working on establishing clinical trials office and the CRO and things like that, so you could start an IRBs and to start opening trials there?
Actually, we do have two FDA-approved clinical trials in Barjeel Hospital that they've been approved, and we're working on them. It's more with my colleagues from thalassemia group. So we are actually working very hard. And in fact, I did just finish writing a paper. The title of the paper, Challenges and Barriers to Implementing Clinical Trials in Cancer Care in UAE. It's under review, and definitely this is an area of interest. And I'm giving also a lecture next month with the regulators, trying to come up with a solution for some of the practical challenges that we have and how to improve the cancer care through research in the UAE.
And it looks like you did not have enough on your plate. So you decided, you know what? I have a couple of minutes every day that instead of sleeping, let me write a book. Like you weren't busy enough, right? You're like, oh, I have like, a couple of hours. Let's forget sleep. I'll write a book instead.
Well, actually, the story of this book actually is interesting because, as I mentioned to you earlier, when I moved from the US to UAE, the first thing I was looking for something like, SEER data, some data availability, so I can just see what's happening. And the other thing was striking to me was the younger population that I'm seeing here with cancer is astonishing. I did a study 2 years ago, which I published last year. I found out after analyzing the cancer data from UAE, 45% of cancer patients in the UAE are between the age of 20 and 49. Wow. Again, 45, almost a half, between the age of 20 to 49. And this is actually what we see in our daily practices. And again, this is different than what we see in the US. Like we see younger, but also we see 50s and 60s and 70s. We do think maybe there is, because our population is young, we do have lots of expats living in the country, but also when we exclude the expat, we still have around 37% of the local population, their cancer between the age of 20 and 49. So when I moved to the US, I was looking for some data. I was trying to compare our data with Saudi Arabia, with Lebanon, with Egypt, and I couldn't find much. There were some, data, but actually they were more about breast cancer in Egypt, colon cancer in Saudi Arabia, but there was nothing like solid where you can sit down and have a look. So I started thinking about writing a paper about cancer care in the Arab region. But after some review, I just realized the topic is way, way, way too big actually for whatever research paper. And I said, you know what, let me consider writing a book and also getting the help from colleagues from across the region. The first challenge was two publishers, actually, they rejected the project because they didn't think it was interesting or exciting. People are looking for exciting topics. I thought it was exciting. I still think it was exciting, and I'm gonna prove to you it was exciting for some reasons. I'm gonna disclose to you in a minute. So I started inviting people to join. This was back in March 2017, and at that time, people didn't know like who I am or what am I trying to do. So I received lots of rejections, and I was disappointed, and I put the project on hold for a few months. But then I was, I said, let's give it a try again. I approached Springer, the publisher, and actually they were very, interested and said, you know what, we did some search and we couldn't find any resources. We think this book is going to be a good book. So I started to work harder on the project to get more published. At that time, I didn't have any research assistant or any research team. I was doing this myself, emailing, receiving the emails, getting people contacts. And I had challenges to reach Somalia. Again, the book is about cancer in the Arab world. The Arab world, by definition, there are 22 countries, starting from UAE, Oman, Saudi Arabia, going to Lebanon, and then Egypt, Libya, and all the way to Morocco. Also, you have Somalia. So I had challenges, to reach, authors from Somalia or oncologists. I had to make lots of phone calls. I had to call some universities to connect me with the local hospitals, from the local hospitals to connect me with the oncologists there. Long story short, we were able actually to reach 19 groups of oncologists from across the region. I was unable to reach any oncologist from Djibouti. I was not able to reach Qatar, and also I was not able to reach Comoros. So these are the only countries I wasn't able to reach. But other than that, I started approaching the oncologists. We had multiple, meetings over the phone. The virtual was not that much 2018, 2019, but we had multiple, phone calls, WhatsApp groups, and we started, building the structure of the project. And I thought it would be interesting also to have some special chapters, for example, cancer care during crisis. And I should mention that, this chapter actually received lots of attention since the Ukrainian war happened, because people were looking for resources, how to manage cancer patients during the crisis. And this was authored by our colleague, Dr. Deborah Mukherjee. And there were also other chapters about radiation oncology in the Arab world, breast cancer, research in the Arab world. But at the end, after 5 years from ups and downs, challenges, it was published in March of this year, and it has been downloaded almost 200,000 times since publication. And it's free access, by the way.
Well, I couldn't download all the chapters. I saw that there are several chapters I could download and
all
read.
Of them are free. All of them.
Okay, I'll look
the entire
again.
Book.
Yeah, I'll look again. I will actually take a look at it again.
I should just mention one thing. It has been named the most downloaded medical book in the MENA region, the Middle East region, in 2022 until now.
Well, I'm not surprised. I mean, I read a couple of chapters, and I am amazed at the amount of research that you had to do to even assemble the information for every single country. So tell me how you did that. You mentioned you try to reach oncologists there, but some of the stats, even the GDP that you mentioned, for example, I mean, do you call the government, the Ministry of Health? Like, how do you? And if I'm the Minister of Health in Egypt, I mean, I don't know, why should I talk to you? Like, I don't know, like, did you pay people per hour? Like, let me just take an hour of your time. I'll pay you hourly rate. Like, I don't know how. I can't even imagine how the process to even start doing this.
To be honest with you,
let me tell you, Ahmed, let me tell you, I mean, I'm from the Arab region. I know how disorganized we are.
To be honest with you, this was a big challenge, and that's why it took almost 5 years, and we had to do multiple revisions for some of the chapters. So what I did was, first, I wrote what I think is right as a UAE chapter. I wrote the entire thing, from A to Z. I got the information. I contacted the Ministry of Health. I got the available information, analyzed them, and also I put like a timeline. If you look at the UAE chapter, there's a timeline. How did the cancer care in UAE started until 2040? Also projection over time. So then I approached our colleagues, for example, in Saudi Arabia. I showed them the project. I told them, we can do this together. Let's get the contact. Let's get the right people on board. So we start getting the group of oncologists who are willing to start to work with us, and I started doing the same every single country. And again, that's why it took lots of time. There were so many challenges, difficulty getting data, difficulty accessing data. Some actually they pulled back from the project because they are afraid from publishing some data. There were many challenges. To be honest with you, one of my colleagues from Kuwait, he told me, Humaid, when he told me about this project, I thought you're crazy and I thought this will not happen. But he said, you know what? Let's see. And he helped with the Kuwait project. But when we published the book, and when I gave him a copy of the book, he said, I cannot believe that we were able to achieve this goal. It was not easy, but certainly, to be honest with you, I still think that it's worth it. And we're preparing now for the second edition with improvement, and also we got some authors from some countries, and we did learn a lot from our experience last time. So hopefully the second edition will be also improved and will have better access to everyone.
So for listeners to the podcast, for each country, and you go through every chapter, every country gets a chapter of the book. As you go through this, what type of information for listeners were you putting in there in each chapter? Like, how were the chapters divided in terms of the information that you wanted to share with readers?
Yes. So basically, we wanted first to have some historical background about the oncology service in the country. It doesn't have to be very extensive, but at least, it's a reference for many generations to come in the future. People will have some understanding. How did the oncology service started? For example, in UAE, the first, oncology center started in 1979. So we put a page and a half, 2 pages about the history and how did the cancer care evolve over the last 30 or 40 years, depend on the age of the country. And then we talk about the current status of the statistics or data available about the cancer registry in the country. And then we talk about the most common cancers. We talk about the also availability of the data. We talk about the cancer control plan, if there's a cancer control plan in the country. We talk about the screening programs, if they're available, if they're accessible. Also, we talk about the quality of care. We also talk about the research in each country. So we try to cover all the aspects of cancer care from A to Z. Definitely you cannot, but at least you will have the themes to cover most of the aspects of the cancer care in each country.
It's very descriptive, right? In terms of like almost, I viewed the book as almost a landscape of what's going on oncology-wise in each country. And at least from the chapters I read, I felt they could be a baseline, like it's something to compare to. So as you start updating and following things, let's say in the UAE, you'll go back and say, this is how it was in 2022, and now it's 2025. You could even look at changing the trends of cancers, because I'm still fascinated when you say that 20 to 49, you've got 45% of cancers. I don't know if that's because of smoking, possible. I mean, people in the Middle East, they smoke a lot. So it is possible that this is the trend, but it is rather unusual to see that trend, and it may change with time as you follow the book with new projects.
Agree, actually, and again, this was the whole idea, to have a baseline. So in the future we can compare, we can make changes. In fact, we just finished the updating the UAE chapter, and the chapter was almost 4,000 words. Now currently it's 12,000 because we added more sections. We talked about AI in oncology in UAE. We talked about oncofertility. We talked about also psych-oncology. These topics that we didn't cover in the first edition. Now we have more information. We have more experience with the current landscape of the UAE. So we're adding more and more about these topics into the newer edition.
I think we can all agree that different countries have different resources. I mean, Syria and Lebanon are just simply not Saudi or UAE or even Kuwait in terms of resources. Does the book offer a path forward for the countries that are less resourced?
Yes.
Somebody like, Lebanon, Syria, even Libya, let's say, do you offer a path forward into what you could possibly do to improve on oncology care?
Definitely. And again, as I mentioned to you, that we did have a section about cancer care in crisis and in war and zone area. And again, these countries, Libya, Syria, Lebanon, they do have war zones, and we did describe the current status of cancer care and what are the practical solutions, how to tackle these issues, and how to improve the cancer care during these crises. But also at the same time, we had a chapter, or actually the introduction, we described the way forward. How can we improve the cancer care in general after reviewing all these countries? There are so many common themes. For example, we need to improve the screening. There are so many countries that have no screening programs. We need to improve the prevention. We need to improve the vaccination for hepatitis, for HPV. We need also to improve the cancer registry. Some countries, their cancer registry actually is very, very basic. So we did provide a table, actually, or diagram, where we had a detailed approach how to improve the cancer care in all the Arab countries, but also in the countries where things are still lacking behind. And to be honest with you, as you mentioned, it was very interesting to learn that the huge variation between the countries. That you have 22 countries, but you have huge variation where you have top-notch countries with advances, where you have nothing in some other countries. So really it was an eye-opener for me, and also learning experience. And again, it's an area of 400 million people, and so it's even bigger than the US, but also the huge variation still exists.
One of the things for oncology, I believe, is that you could be the best oncologist, the smartest oncologist, right?
But yeah, no resources.
But you need a surgeon, you need a radiation oncologist, you need a pathologist, right? I mean, you cannot actually execute on clinical care unless you have this multidisciplinary care. And I think that is where the biggest pitfalls is. In order for you to do the right clinical care that you really want to do, you want to make sure you have all of the disciplines around you that are able to enable you to do the best care. As you wrote the book across the 22 countries that you described, did you feel that, how did you feel that the other disciplines, not medical oncology, in terms of their availability and strength across the Arab world?
Well, actually, I should say the variation still exists. I'll give you a very simple example: palliative care. Some countries they have no palliative care physicians or any infrastructure for palliative care, no hospices. This is a very small example because again, palliative care, we're all exposed to palliative care in our career, but also the surgical skills, pathology, molecular testing. Molecular testing actually was one of the topics that was very obvious. There are some challenges in some countries because if you don't have a proper molecular testing for some diseases, you are unable to diagnose them very well. And this was a very common theme. So pathology and also accessibility to radiation. Some countries they don't have access to radiation. For example, Somalia, they have very limited, and patients may wait for months to wait to get any radiation.
Yeah, and these are, I mean, even for example, at the UAE, you feel you have good support around you in terms of other specialties?
Yes, because again, the UAE actually we do attract top talents, oncologists and hematologists, and also surgeons. We do have surgeons trained at MD Anderson, Mayo Clinic, Cleveland. They're not working in the main hospital, but we are working in different hospitals. Even in our group, we do have highly trained physicians. Again, we do try to select the highly trained physician to be part, as you mentioned. If the surgeon are doing their job right, my task is going to be very tough to fix whatever they do.
Right. It's amazing how, as you're starting to update the book already, just like a year ago it was published. I got struck by 4,000 words to 12,000 words. I mean, it just seems there's a lot to talk about. Really a lot to talk about. So as you did this, can you maybe share with us couple of things that really stood out and really struck you? Like you were not really expecting them, but you did the research and like, wow, either positively or negatively. Anything that just stands out that you can think of?
Okay, so the first thing actually I learned was the passion of the oncologists across the Arab region to do research. Many actually people they were very keen, excited, and they were willing to do an extra work to get involved in research. So this is something that I learned because many they're still approaching me trying to do some research, work with us, even if they have no resources. And if you see many physicians practicing in the US or Canada or Europe, they're actually from the Arab region. So we are not lacking of brains or talents. We're just lacking of the infrastructure and ability to retain these experts in the region. So this is the first thing I learned. And the second thing was the poor data availability in our region. And this actually is very, very critical. If you're planning for any cancer care in our region, you cannot do that without understanding exactly what you're dealing with. You cannot plan for screening, you cannot plan for prevention, you cannot plan for resource allocation without understanding exactly what you're dealing with. So this is actually a major issue in many of the Arab region that need to be addressed. Also, the difficulties with in some countries to access treatment. Some patients some countries they have no national coverage for their patient, and some countries very difficult to get treatment for cancer. And if you get cancer, it means that this is the end for you. That you have to sacrifice your life saving, your accommodation, your house, and everything you have, which is really sad.
Yeah, that's amazing. Well, there's a part of healthcare, though, that I call it friendly competition. I mean, wherever we are, I mean, as you know, for example, when at MD Anderson, you were competing with some local hospitals as well as national hospitals. In the UAE, who do you view your competition in the Arab world when it comes to healthcare? Because I gotta believe, that's my MBA talking here from an economic perspective, I gotta believe that some of this, again, there's a clinical care, but also, you know what? If we can get people flying to see us in the UAE, more power to us. We are going to make more revenue to the country or the hospital, whatever it is. As you explored the Arab world and you actually looked at the region comprehensively, who can you tell which countries provide the most medical competition to the UAE?
Saudi Arabia. Without
Arabia.
thinking.
I was gonna think Jordan as well. No,
actually Jordan they do, but the resources not as much as Saudi Arabia. Saudi Arabia actually they do have big institutions, King Faisal, for example, in Riyadh. They have also the multiple institution across the country. Lebanon, they have AUB, American University of Beirut. King Hussein also, as you mentioned. But certainly Saudi Arabia will be the center that, I see that, they are a hub for cancer care, plus the AUB, plus or minus the AUB in Lebanon. But the AUB Lebanon, they do have the challenge with the financial crisis, economical crisis. So not everything available easily in Lebanon.
Well, at Saudi, they don't have you. So, hey, that's,
no, they do have excellent physicians in Saudi Arabia.
Not you,
what?
Not you.
I would like to mention this because many physicians or even healthcare providers they don't know much about Saudi Arabia. Saudi Arabia, they have an excellent health system, and actually, even when it comes to the cancer care, they have one of the most outstanding, cancer centers in the Arab region. They even did their first CAR T cell a few months ago in Saudi Arabia.
Wow, I did not know that. Humaid, anything I should have asked you that I may have forgotten to ask you? And by the way, can you tell us how do people can access the book? They can
just Google.
They can buy it.
They can buy it as a hard copy, and the cost is $39 US. We made this, making sure that this is gonna be just the cost of publication. They can access the book by Googling cancer in the Arab world. It will be the first thing Springer page. They can download the entire book for free without any challenges.
Or they can purchase it if they want to have it as a hardcover.
Yes.
Yeah. Anything I forgot to ask you, or anything we forgot to discuss that we should have talked about or shared with listeners?
Family.
Talk about
the family, because I always like to talk about my family.
Yes.
My wife, my kids, and how important the family at work. I mean, in our career, in our journey with medicine, it's always challenging to balance family and also to have kids. I do have 6 kids, and I had my kids during my fellowship and my residency. And if time goes back, I would love to spend more time with them.
Tell me about that, actually. That is a very good question. Do you feel you have good life-family balance practicing medicine in the UAE versus when you were at MD Anderson?
Certainly, yes. Certainly. For various reasons, I think this is maybe because our families are here, because we live nearby. Also, the working hours are actually, they're not much different, but we do have some flexibility with the working hours. Even though I do clinic every single day, you asked me this question, but I didn't answer. I do have clinic every single day and during the week, because again, we are just super busy. Whatever we do when it comes to research is after hours, and I do it because I enjoy doing this. If you ask me to go to the cinema or sit down to write a paper, trust me, I would love to sit down at home, writing a paper and having the kids around me.
So how is it the balance is better, because you are 5 days a week, every day? I mean, and then you for after hours.
Also the support. Also the support I have. I do have a big team that supports me. I mean, the US, it's mostly that it's a consultant or physician based, but here I do have multiple colleagues. They are specialists. They're like they're not fellows, but they are they are not consultants. The grading here is different. So you're a consultant or specialist. So I do have that 4 or 5 specialists working with me. I do the supervision. I make the decision. I try to help with the notes, but I don't spend too much time writing notes, writing orders. I split the work between them. So we try to find the balance. We try to get 2 days a week off, every one of them. And certainly this is very important for the life balance with everyone. So that's why, you have the flexibility to have a bigger team, support team, which is different than what I had, during my time at MD Anderson.
I've enjoyed this immensely. I mean, this is really amazing. What you have done is it's very difficult to do. It's really kudos, congratulations. Not only just for writing the book, but really having the perseverance, the tenacity to to tolerate a lot of inconveniences, challenges in, as you build an oncology program and put the UAE on the forefront of oncology. So congratulations on everything you're doing. And I'm going to take a commitment from you that we're going to bring you back on the podcast next year so we can look at the progress. But I'm hoping to see you in person as well in a few months.
Inshallah. And we are writing our book, Palliative Care in the Arab World. And this is a separate book because we do know that, it's very critical to bring this concept. And hopefully also we'll have our new edition of the Cancer in the Arab World as well by then.
Yeah, I'm not sure where you find the hours, but maybe you have more than 24 hours in the day in the UAE. Well, Dr. Humaid AlShamsi, thank you very much for coming on Healthcare Unfiltered.
Thank you so much for having me. Thank you.